So, good day everyone. I am Tara Baloy JNG, a first year student from Mati Doctors College, and for today, I will be doing a return demonstration of the physical examination or the cephalocaudal assessment. And for this video, we will only assess the head up until the breast. Okay, so let's start. But before we assess our patient, let's make sure to wash our hands first and then after sanitize. Okay, so after washing our hands, we're going to sanitize first using an alcohol solution to deter the spread of microorganisms. And then after, we're going to wear a clean gloves for our protection and also to keep all the pathogens away while doing the procedure. So I already wear a gloves, and then next, identify the patient and explain the procedure to the patient. So, good morning, ma'am. I will be assessing your head, neck, and face for today. But before I will going to assess you, may I know your name first po?
Cheryl Manok,
Okay. Your age, ma'am?
18.
18 years old. Okay. Okay. So, our assessment for today po, we're going to assess your head, neck, and your facial po. Is it okay with you if during the procedure may I touch some part of your face or neck? Is it okay na? Okay. After identifying and explaining the procedure to our patient, it makes the cooperation and it makes them more comfortable while doing our procedure. So next, let us have our patient sit in an upright position and have their wings, piercings, or some tupis removed while we're doing the examination. Ma'am, do you have any accessories to wear? Okay po. Okay, so next, let us inspect and palpate the following. First is their skull for the size and shape, contour, and its position. Okay, ma'am, may I hold your scalp for a moment? Okay, we're going to inspect the skull and the head for the skull for its shape and to identify if there are some tenderness. Inspect the skull. Ma'am, do you feel any pain while I palpate your skull po? Okay. The skull. Okay. So upon palpating the skull of the patient, there are no tenderness or abnormalities on her skull. So next, we're going to inspect the skull for color, texture, or if there are any lesions, and the hygiene and tenderness. Part of hair in several areas to inspect fully. Ma'am, I'll inspect again your skull and check for some lesions or if there are any dandruffs or fleas. Kuding ini. Okay, ma'am. Okay. So there are no tenderness or any lesions on her skull. So next, we're going to inspect the face for color, proportions, and expressions and movement. So next, on inspecting the face, we're going to assess the trigeminal and the facial nerves of our patient. So first, we're going to instruct the patient to clench teeth while I'm going to palpate her jaw. Okay, ma'am, can you follow my instruction po? Just clench your teeth like this. Okay? While our patient is clenching her teeth, we're going to palpate this part or the jawline part. Okay, ma'am, do you feel any pain or uncomfortable? Okay, so there are no abnormalities. Okay, so next, let us assess the patient cranial nerve 11 or the spinal accessory. So let's instruct the patient to shrug their shoulder against resistance of my hand upon putting my hands on her shoulder. So ma'am, may I hold you for a moment po? So I'm going to go at your posterior side. Okay, ma'am, just shrug your shoulder while I'll put a strand on your... Okay, ma'am. Do you feel any pain while doing the assessment po?
No.
Okay. I'm going to repeat the procedure po. Ma'am, do you feel any pain? Can you struggle for a moment? Okay. So there are no abnormalities or any pain that our patient feel. So next, let us inspect the neck for symmetry, masses, scars, and ask patient to bend neck forward and backward and in a rotation motion. So ma'am, can you bend your neck for a moment like this po? Okay. So inspect for symmetry and for scars or any lesions, and then can you bend your neck for a moment like this po? Okay, there are no symmetry or okay, and then rotate po your head. Okay. Okay, so there are no abnormalities. So next, let us inspect and palpate the trachea for location and place the thumb on each side of the trachea, just above the suprasternal notch. Avoid forceful pressure. So this, ma'am, may I hold your trachea for a moment? This part po. So upon palpating, let us ensure that our palpation would be a light palpation only so that our patient would be comfortable. So, ma'am, can you move? Okay. So upon palpating, ma'am, do you feel any pain at this part? Okay. Nothing, ma'am. Okay. So there are no pain or abnormalities. So next, after we palpate the trachea of our patient, let us assess the lymph nodes of our patient. So first, let us make sure that our patient is sitting in a comfortable position with her neck is being relaxed at the moment, and then let us inspect and palpate both side of the neck of our patient. Ma'am, okay, we're going to assess your neck po, looking for some lymph nodes or some abnormalities. Okay, so let us palpate the lymph node chain of our patient systematically. So we're going to palpate the patient's lymph node from the pre-auricular. Ma'am, I touch you for a moment po. From pre-auricular, this one, we're going to palpate. Ma'am, do you feel any pain at this part of your lymph nodes?
No.
Okay. So next, we're going to palpate the post-auricular at this part. Post-auricular. Ma'am, do you feel any pain? Or and assess for some tenderness or if there are any lymph nodes. Next, for the occipital, this part. Ma'am, do you feel any pain or uncomfortableness? Next, for the submental, this one. Ma'am, is it okay lang? Okay. Next, for the submandibular, this one. Ma'am, is it okay? Do you feel any pain or not? And then next, for the jugular dysgastic. Okay, this one. Ma'am, do you feel any pain? And then next, for the superficial cervical, this part. Ma'am, do you feel any pain? Okay, next, for the posterior cervical at this part, ma'am, do you feel any pain or confidence? And then lastly, for our subclavicular or our clavicle part. Ma'am, do you feel any pain? Okay. Upon palpating the lymph nodes of the patient, the patient didn't feel any pain or any abnormalities while palpating. And then next, ask the patient to bend her neck forward. Ma'am, can you bend your neck forward po? Okay. And then relax shoulder and palpate the supraclavicular muscle. The supraclavicular nodes even. Okay. Ma'am, do you feel any pain po? Okay. So there are no abnormalities that our patient feel. Okay. Next, we're going to assess the thyroid of our patient. So first and foremost, we're going to stand in front of our patient and inspect for her lower neck overlying the thyroid for any symmetry, size, and if there are any abnormalities. Ma'am, I'm going to inspect your thyroid po. Okay, and then next, provide our patient a glass of water. Okay, ma'am. Upon doing the procedure, I'm going to let you sip a small amount of water and then just wait for my instruction before you swallow it po. Is it okay po? Okay, ma'am. You can take a sip po. Okay, ma'am, just wait for a moment po. Okay, okay. And then after, let us palpate the thyroid of our patient. Ma'am, I'll hold you po for a moment. Okay, ma'am, can you swallow the water for me po? Okay. Okay. Okay, so after our patient swallow the water, note for any bulging activity while our patient swallow the water. So next, on the posterior approach, I'm going to put my hands around the client's side of her thyroid and palpate the left lobe with the pads of my hands and the middle fingers. So, okay, the left side. Ma'am, I hold you for a moment po. Okay. Ma'am, can you swallow for me? Okay. And then at the right side. Okay. So, when palpating, there are no tenderness or there are no abnormalities while I palpate the both side of her thyroid. So that's all for the assessment in head, in skull, facial, and neck. Okay, so after we finish assessing our patient's head, neck, and face, let us move forward on assessing the nose, sinuses, and mouth. So for first procedure, let us examine the nose, sinuses, and the mouth of the patient. Asymmetry may include trauma or may have any patency. So let us examine first the nose, the sinuses, and the mouth of our patient. Okay, let us inspect the nose externally for placement, alignment, symmetry. If there is any swelling or disformalities exist, palpate more gently for tenderness, swelling, or deviation. So next for let us place our fingers on the side of the patient's nose and occlude other nares or the nostril while client breath with mouth closed. So after, we're going to repeat on the other side. So ma'am, is it okay if, do you feel comfy if I will be the one to make like this, or you'll be the one to, I know your,
I will be
okay, just follow my instruction po. Okay, so just do like this, ma'am. Okay, and then close your mouth and then inhale, exhale while mouth is closed, and then repeat on the other side po. Inhale and then exhale. Do you feel any uncomfortableness? Okay, so next use a pen light to illuminate anterior nares and inspect nasal mucosa and position of septum at anterior end of the nose. If nasal tubes are present, inspect for excruciation, inflammation, or sloughing of skin. Okay, so after that, we're going to use a pen light to illuminate anterior nares and inspect for nasal mucosa and position of septum at anterior end of the nose. If there are nasal tubes are if there is a nasal tube present, inspect for excoriation, inflammation, or sloughing of skin. So for this procedure, we're going to use our instrument, which is the pen light, to assess for any nasal or nasal mucosa or if there are any inflammation on our patient's nose. So ma'am, can you look up for a moment, and then I'm going to use a pen light po. Is it okay? Okay, ma'am. And then inspect for if there are any nasal mucosa or inflammation inside our patient's nose. Okay, so after we examine and inspect our patient's nose, let us percuss and palpate the frontal sinus over the bridge and upper orbit of each eye of our patient. So ma'am, may I hold you for a moment po for palpation and percussion? Okay, let us inspect. Let us palpate and percuss. Ma'am, do you feel any pain?
Nothing, no.
Okay, this part po, ma'am.
No.
Okay. That's all, ma'am. Okay, and then next, percuss and palpate the maxillary sinuses just to each side of the nose. Okay. Ma'am, do you feel any pain?
No.
Okay, inspect for tenderness as well. Okay. Okay. There are no abnormalities or there are no tenderness upon palpating and percussing. So next is, if sinus tenderness is present or infection is suspected, transimulation should be performed. So upon performing transimulation, we're going to darken our room so that we can view the maxillary sinuses by placing the transilluminator light in a lateral position to the client's nose, just beneath the medial aspect of the eye. So we're going to darken our room. Okay, so after we darken the room, view the maxillary sinus by placing the transilluminator light in the lateral to the client's nose, just beneath the medial aspect of the eye. And then, next, have client to open mouth and check to see if hard palate is illuminated. Ma'am, can you open your mouth for a moment po? And we're going to assess your mouth. Ma'am, can you wide it more? Okay. Okay, so next, we're going to have, while our patient's mouth is open halfway, we're going to inspect for her lips for its color, texture, hydration, and symmetry, or if there are any lesions. Ma'am, I'm going to inspect your lips po if there are any lesions. Okay. So there are no lesions. And then after, inspect the inner mucosa and gently pulling her lower lip from the teeth. Just, ma'am, may I hold you for a moment po? Okay, just hold it. Okay, and then upward. Okay, there are no lesions. And next inspect the lining of the cheeks by gently retracting lips and cheeks with the tongue depressor. View the surface of the mucosa on the right and left to bottom. Ma'am, can you open your mouth? Okay. Okay, so while retracting the cheeks, and inspect for gums for its color, if there are any edema or retraction or any bleeding, and ask client to if there are any tenderness and if there are any dentures to be sure that they are removed. So ma'am, I'll hold you again po. Okay, so ma'am, can you open your mouth for a moment? The gums, if there are any edemas. Okay. Okay, so there are no abnormalities or edema. Okay, to assess our patient's tongue properly, we're going to use a tongue depressor so that we can note the size, position, and texture upon inspecting. So, inspect the undersurface of the tongue by asking the client to lift the tongue toward the mouth. And, ma'am, can you open your mouth for a moment po and then lift your tongue po like that. Okay? And to palpate the tongue, first, we're going to explain the procedure to the patient, then ask the client to protrudes the tongue, and then grab the tongue depressor, and then inspect for any lesions or edema. Ma'am, can you open your mouth po and then like that one, and then inspect for any edema. Okay, there are no. So with client extending head, backward and folding mouth, inspect the hard or soft palate using the pen light for illumination. And can you move forward? And then the palate, what palate? Ma'am, can you say palate for, okay. Okay, so, and then after, ma'am, can you open your mouth for a moment again po? Then after, check for any tonsils or lesions on our patient's mouth. Okay, so there are no. Okay, so there are no lesions or tonsillitis in our patient's mouth. And then that's it for the sinuses, nose, and mouth assessment. Let us open this one. Okay, so that after we finish the procedure, we're going to discard the glove and the receptacle after we finish the assessment. So we're going to put it there. Okay, so that's it. Okay, so after we finish assessing our patient's nose, mouth, and sinuses, let us move forward on assessing our patient's eyes and ears. So see that I already sanitized and washed my hands after assessing our patient's after the last assessment on our patient. So next, let us test the visual acuity of our patient, which is the cranial nerve 2 or our optic nerve. So next, if the client wear glasses or contact lenses, ask to read print from newspaper while wearing glasses. And then note the distance from the eyes that client holds the newspaper. So our patient didn't wear any glasses, so she won't remove anything. So next is, if client is unable to see print clearly, test each eye separate by placing index cord over one eye at a time. A more detailed examination involves using a Snellen chart. So first, let us make our patient read, but we don't have any newspaper, so we assume that this manual would be our newspaper. So, ma'am, we're going to assess your reading for this part. Is it okay if I'll make you read this part just like this? Is it clear? You can read the textbook. Can you read this textbook for a bit?
Assessing the eyes and ears.
Okay, so our client can read these small letters in our manual. And then next, excuse me, with a great distance, we're going to make our client put some index cord. Ma'am, can you hold this for a moment po? And then I'll instruct you what part of the eye you're going to put that index so that it can be covered. Okay, can you cover this part of your eyes po, the left part of your eyes? And then assuming that this is the exact distance when reading a Snellen chart. So ma'am, can you read this po from E to this one?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D.
Okay, so next, ma'am, can you put that on your right side? So just like this.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D.
Okay, so our patient read it all without any complication or without missing every letters at this Snellen chart. So the result of our patient visual acuity would be 20/20. So okay, next, let us test the visual fields of our clients. So first, we're going to have our patient sit or stand in 60 centimeter or 2 feet away and then face you or face the examiner. And then your eye should be at an eye level of the client. And then next, ask client to gently close or cover one eye and look at your eye directly opposite. And then close or cover other eye on the side of the client's closed eye. So ma'am, can you cover the right part of your right eye for me po? Okay, so while the client cover her right eye, I'm going to, ma'am, can I call you po? Okay, so like that. So like this, and then the nurse's field of vision is superimposed to the client, on the client. So ma'am, can you look directly at this part po? And then look at this part po, ma'am. Okay, so next, move here. Okay, so next, hold something or an object up to 15 to 30 centimeter or 6 to 10 inches in front of our client's eye, and then ask patient to follow the movement of the object with her eye, keeping the head still, and move the object slowly. So ma'am, as I move this object, can you directly follow where the object move, and then just like that. Okay ma'am, are you ready po? Okay, so just this just this just this enough distance. So ma'am, just follow this object po. Okay, that one from the other side, and then that one to the bilateral, then down and up. Okay, and then next, the nurse keep the finger with the normal field of vision. So nurse observes parallel eye movement, position of the upper lid in relation to the presence of nystagmus, rhythmical, and oscillation of the eyes. So next is to test the pupillary reflexes or the cranial nerve 3, which is our oculomotor. Okay, so a dim room lights to test the reaction of light. So we're going to dim our room again, just this one, so that we can clearly see, or this part would be dark. Okay, use our pen light as our equipment while testing the eye of our patient. So next is, after we dim our room, let us make our patient look straight ahead, and then move light source from the side of the client's face, direct to the light and to the pupil, and observe if the client's pupil constricted or dilate. But it must be constricted. Okay ma'am, I'm going to assess your eyes po. Is it okay if I use this light for a moment as I inspect your eyes po? Okay, ready ma'am? Okay. Okay, as I can see, the client's pupil constricted. So observe the papillary response of both eyes. Normal pupils are round and equal in size with a brisk response, just like what happened earlier while I put the penlight at her eyes. Okay, so after we finish assessing the pupil, we're going to open our lights again so that we can clearly see the peripheral vision of our patient. So next is to test the accommodation. We're going to ask our patient to look at the wall in distance. Ma'am, can you look at this part of the room for a moment while I assess your peripheral vision? And then next is to put your fingers smoothly toward the nasal bridge, and then for 10 to 15 centimeter. And then, ma'am, do you see this? Can you see that? Can you see this po? Using your peripheral vision.
Yeah.
This one po. No. Again?
Yeah.
That one. Okay. After the peripheral vision, we're going to move our fingers smoothly toward the nasal bridge and watch for pupil constriction and convergence. So, okay, next we're going to move our fingers smoothly toward the nasal bridge of our patient and then watch for pupil constriction and convergence. So, ma'am, upon doing this procedure, I'm going to ask you to just to look at this index finger, and then focus at this part po, okay? So that we can assess the constriction and convergence of your pupil. So, ma'am, can you look at this po? Okay. Okay, so the constriction and convergence of our patient is aligned because the two pupil move at the center part as my index finger go toward her nasal bridge. Okay, so next we're going to examine our patient's external ear. So first is to inspect the auricle for the placement, the size, and the symmetry and color. So ma'am, can I hold you for a moment po at your ears? Inspect if there are any lesions. Okay, next one. Okay, so next is palpate the auricle for texture, tenderness, and the presence of lesion. If the client complains of pain, gently pull auricle and press the tragus behind the ear over the mastoid bone. So we're going to palpate the auricle part. Ma'am, do you feel any pain at the moment? This part? Ma'am, do you feel any pain? If this one, ma'am, do you feel any pain? This part? Do you feel any pain?
No.
Okay, so there are no pain that our client experienced. So next, we're going to observe the opening of the ear canal for lesions, discharge, swelling over the foreign bodies, and for any inflammations. The illumination should show a clear and translucent tympanic membrane. So just expecting that this is an otoscope or the right equipment to assess the ear canal of our patient. So right now, we're going to inspect your ear canal po. Okay. So, this part po. Okay, so there are no swelling or lesions. And then next is to assess the hearing acuity. First is to ask our patient to remove any hearing aid or and close her eyes and then test one ear at a time. Ma'am, can you hold this? Ma'am, do you have any hearing aid at the moment that you're using? Okay, none. So can you put the other part of your hands on the right side, and then next is to stand and 15 to 60 centimeter or 6 to 12 feet away, and then exhale fully and softly whisper a sequence of numbers with two equally accented syllables. Ma'am, can you do this po? Okay. Do you hear my exhalation po? Okay, and then love. Do you hear that po? 9. Okay? So, ask patient to repeat the conversation loud in loud tones if needed. Ma'am, kindly repeat what I said po, okay? Is it okay? So, 5,
5,
4,
4,
9.
9.
Okay? So, and then, next is to, if hearing loss if suspected, perform the tuning fork test to determine if client can hear voice tones and reflect hearing deficit. So, assuming that this is our real tuning fork, obviously, this is the fork we usually eat we usually use when we eat, but just assume that this is the real tuning fork. So first, we're going to tap this at our palm or any hard object so that it would have a vibration or it would make a sound. So we're going to tap this one and then put it here at the hairline. Ma'am, do you hear any sound, ma'am, at the both of your ears?
Yes.
Does it equal or
Equal.
much sound here?
Equal.
Okay. So after testing using the tuning fork, next we're going to assess the Weber's test. So again, we're going to use the fork at its base and then tap lightly against the heel, just like what I did earlier. And then place the base vibrating fork on the midline of the vertex of our client's head or the midline of the forehead. And then next is ask client if sound is heard equally in both ears or in one ear only. So I did it already earlier. So next, let's move forward to the next procedure. Just like what I did earlier, I put this and then ask if she hears the sound at her both ears or just only at the side or at the side. But apparently, she hears both equally. Okay, after making the Weber test, next we're going to test the Rene test or the Rain test. So first, we're going to place the stem of the vibrating tuning fork against the client's mastoid process. And then next, ask client to tell when the sound is no longer heard. The nurse observes the length on the time and seconds using our watch, and then quickly still vibrating less to 1 to 2 cm or 1/2 to 1 inch from the ear canal. And then next, ask client to tell you when the sound is no longer heard. Again, watch time at your watch, and then compare the number of the seconds for bone conduction and air conduction. Okay, so okay, at this side naman po, ma'am. Okay.
Stop. Stop.
Okay, so we're going to record. Okay, so and that's it for assessing the eyes and ears of our patient. Okay, after we finish assessing the eyes and ears, let us move forward to our last assessment, which is the breast assessment. We're not going to assess the lungs and the thorax anymore, but only the breast. So again, good day, ma'am. I will be performing a breast assessment for you today po. And don't worry, because I will assure the privacy and then explain the procedure to you before I start the procedure and obtain a consent from you po. So before we start, I'm going to provide the privacy, close the curtains, so that you would be comfortable throughout the procedure. So ma'am, may I get your consent po so for today I will be assessing your breast po. Just tell me if you're getting uncomfortable while I do the procedure, and just tell me when to stop or it makes you uncomfortable. Is it okay, ma'am, if I hold your breast po while doing this procedure? Okay, so next is to, after we provide the privacy, we're going to properly drape our patient. But for this, we're going to assess her while she was sitting in a comfortable position. And then inspect the breast for the size, shape, colors, and any abnormalities. Begin palpation using the pads of our fingers. So ma'am, can you move for this a little? Just like this po, and then like this. And then move forward. Okay, and then backward. Okay, upon making her move, I can see that her breast is in symmetry form. So next is we're going to do the circular method or the spiral method, wherein we're going to start at the outer part of the breast, and then we're going to move our pads or our fingers in a circular motions, and then gradually we're going to move it and up to the nipple part of our patient. So, ma'am, can you do this position po for a moment? Like this at your right side po, at your right side. At your right side, ma'am. This part po. Yeah. Okay. So, upon doing the palpate, we're going to palpate the breast of our patient. Ma'am, may I hold your breast po? Is it okay? Just tell me when you're getting uncomfy po. Okay, so, upon palpating our circular motion, we're going to start. Ma'am, can I hold you po? Okay, we're going to start at the outer part and then up to the nipple of our patient. So, this part in a circular motion with a light pressure only and moderate. Okay. Ma'am, are you getting uncomfortable while I do the procedure po? Or is it okay? And then inspect for if there are some lymph nodes or some lesions. We're just going to assume that we really inspect the breast without any clothes. Okay? 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 So, ma'am, can you move at this part? The left part naman po. Okay? Just like we do at the right part, we're going to do a circular motion at her left breast. Okay, ma'am? Slightly. Circular motion. Ma'am, did it hurt or do you feel any pain while I'm doing the palpation? While I'll palpate your breast. Okay. So there are no nodes or something. Okay. Okay. So next, after we do the circular way of breast assessment, let's move forward to the vertical method or the up and down strip pattern way. So first, we're going to start at the top of the breast near the clavicle, and then next, move your fingers or the pads of your fingers downward in a straight line, and then move slightly to the side, then go upward again, continue up and down like vertical strip pattern. Move from the axilla down to the breast fold. Okay, ma'am, we're going to do again. We'll do like this again. Okay, so we're going to do the vertical way or the vertical method from this part, the clavicle part, to downward and then up and then down. Okay, ma'am, I'm going to start the procedure po. Just tell me when you're getting uncomfy. Do you feel any pain, ma'am? Okay, then upward. Okay, and then observe if there are any lesions or moles at the breast. Okay. Do you feel any pain, ma'am, at this part? Okay. Okay, at this part na naman po. The left side. Okay, ma'am, I'm going to still palpate this part. Does it hurt or do you feel any pain? Okay. Do you feel any pain, ma'am? Okay. Upon doing the palpation, still observe if there are any lesions or there are any cysts if there are any cysts in our patient's breast, but there is no abnormalities upon palpation. So lastly, we're going to do the wedge method or the radial pattern or the ridge ways. So first, we're going to start at the nipple of our patient and move our fingers outward toward the edge of the breast, and then next return to the nipple and then move in another direction like a slice of a pie, and then continue until the whole breast is assessed. So ma'am, again, we're going to assess your breast po in a wedge way. So I'll start na po. Okay, so we're going to start at the nipple part at the center. So ma'am, I'm going to hold your breast po. Okay, do you feel any pain? Okay, just like that. Then after, we're going to go back here and then palpate. That one. Do you feel any pain, ma'am? Or uncomfortableness? Just tell me when to stop. Okay. Okay. Just a light palpation with a light pressure so that our patient won't be hurt. Still feel what is inside. Okay, ma'am. The left part. Okay. Do you feel any pain, ma'am? May katawag.
Okay, sa bahay sila.
Okay, do you feel any pain, ma'am? Okay. Okay, that's it. Okay, so upon palpating the breast of our patient, I didn't feel any cyst or something that makes her breast in an abnormal state. So next, we're going to palpate the axillary area for lymph nodes and then see if there are some lesions or lymph nodes that we can palpate. We can palpate. So assess the. Okay, ma'am, make can you make like this? Okay, so I'm going to palpate your axillary part of your breast. Okay, next this part. Ma'am, do you feel any pain? Okay, and then after that, we're going to assess our patient in a comfortable position and then make them comfortable. Ma'am, after our procedure, are you okay po? Are you feeling comfy or not? Okay. Okay, so next, after we finish the procedure, we're going to discard our gloves at the receptacle, and then after we finish discarding our gloves, and then our patient is already in her comfortable position. So that's it for assessing the breast, and that ends for our that ends for my return demonstration and physical assessment. Ma'am, thank you for your cooperation po. Again, this is Teraba Louis Jane G from first year nursing student. Then that's all. Thank you.